All right, welcome to EMT Essentials. In this video, the first of many, we're starting with the very basics. What EMS is, what it does, and why it's essential to healthcare in everyday society, in our community. This will set the foundation for everything else we'll cover, so grab a cup of coffee and sit down. This might just be the best course you will have ever taken. EMS is more than just ambulances and sirens. It's really a coordinated system of healthcare providers who respond quickly to emergencies and non-emergencies too, to be honest. Think of it as a relay team where everyone has a role, from dispatchers to EMTs to ER doctors. We all work together, plain and simple. Once you complete an EMT approved course, you will be eligible to take the National Registry exam or your state certification exam. If you are one of my students enrolled in an approved program, you are set. If you just found this video online, great job. I'm really glad you're interested in EMT training, but you will have to sign up for an approved program. These videos posted online are not an approved program in and of itself. For now, the online content we offer does not qualify to sit for the National Registry exam. It was really designed as an aid to help you study for your actual course exams and prepare for the National Registry exam when you need to take it. Maybe one day this course will count, but for now, not. So pass that exam and you're licensed to work as an EMT, your official ticket into the EMS workforce. I really hope you stick with it. I really hope you pass the exam. This is what this is here to help you with. It's really a beautiful tool to have in the back of your pocket, regardless of whether you're going to stay in this field or not. And it's really provided me some of the most amazing experiences. So let's take a look at the four main levels of EMS training. Imagine a high school sports injury. Initial support might be from a school nurse or athletic trainer that's already on scene at the school. The EMT shows up in the ambulance. The advanced EMT might start an IV if they're on the ambulance or they arrive shortly thereafter. And if things are serious, a paramedic is there or will get there with advanced airway tools and medications. Now, for some newer features of the EMS system, in some scenarios, a patient already at a hospital might require services that are not provided at their current hospital. In these cases, a critical care transport unit nurse with a nurse, right, might have to deploy to transfer this patient with an advanced airway and medications and medical devices that exceed the scope of a paramedic. Don't worry about that stuff for now. More on that later. And in some major metropolitan areas where the emergency medical system is heavily impacted by non-emergent calls, a nurse practitioner might be on a ambulance style vehicle that looks like an ambulance, and that might be deployed so that a patient can be checked up, have some tests taken, maybe some blood taken, and prescriptions can even be refilled in some cases. This is part of programs usually called mobile integrated health or community paramedicine, and it's another wonderful expansion of our system. It's a promising solution for people with barriers to regular medical care. More on that later also. So don't worry about those two, but just trying to lay some seeds into your mind for future career progression, understanding of the EMS system, all of that good stuff. So these are the 6 important levels to be aware of. Throughout this course, think about ways that you might interact with medical professionals at different levels, and think about career progression while you're at it. That's why I mentioned some of these things. As an EMT, you'll master CPR. You'll learn to use an AED. You'll manage airways. You'll assist with medications like EpiPens. And most importantly, you'll safely transport patients. These skills are the backbone of effective emergency care. As EMTs, it's not always possible to reverse injury or illness on scene. Our value is in damage control as we aim to prevent the problem from getting worse, as the road to the hospital is rarely smooth. And I mean that both figuratively and literally. A full approved EMT course includes classroom learning, hands-on skills practice, and realistic scenarios. Picture treating a patient in a simulated car crash. It's all about preparing you for the real thing. We'll add in patients that scream and all the tools you'll need to use and barriers to access the patient, and even a patient who's acting really well and screaming at you as you're trying to help them. We really try to paint a beautiful picture that will set you up for success once you're in the field. Your training will cover how to quickly assess the scene, treat patients, and make split-second decisions, all based on our policies and protocols, which you'll learn. You'll also learn how to prepare a patient for transport while staying calm under pressure. Very important things. Now, for your license or certification, each state has different requirements, but you'll generally need a high school diploma or equivalent, some immunizations, drug testing, and a clean background check. A valid driver's license is also key, especially because most companies that you will start at will require you to drive as well. Now that you're going to invest some time and money into learning this material, let's aim to avoid doing something stupid that might get in the way of a great job offer. There are plenty of stories of people getting arrested for stupid things like a DUI after their fire academy or police academy graduation party. Actual sad stories. After all that work, they've lost their job and they likely won't ever be hired in public safety again. So don't do it, ever. Especially now that you're embarking on this journey. Protect your investment. Make smart choices. The Americans with Disabilities Act, ADA, ensures you can't be denied a job in EMS just because of a disability, as long as you can safely do the job. Now, there is a lot on the line for us, and employers must provide reasonable accommodations. That being said, EMS is hard on your body regardless of your current shape. Long hours, inconsistent sleep, stress, poor nutrition, just to name a few. Keep that on your mind. Your personal well-being will be a theme early on that we'll talk about, and will have to be a personal priority for you. Get sleep, eat well, get exercise, and avoid BS where possible. That's my plea to you from the start. Now, imagine someone collapsing in a crowded store. You arrive, assess for a pulse, breathing, start CPR. Great start. Your partner applies the AED while a firefighter applies oxygen. You're still doing CPR. Paramedics arrive and push some medications. Together you move the patient onto a gurney and continue CPR en route to the hospital. Just before arriving at the hospital, you can feel a pulse and the person starts breathing on your own, although they may not be fully conscious yet. But they're breathing and their heart's beating. Your quick actions restarted their heart. That's EMS in action. That's what's possible. Not always a guarantee, but the big picture can really be quite beautiful when it works well. Now that you understand what EMS is and why it matters, we'll dive into how it all started. In the next video, we'll explore EMS's roots, from battlefield medicine to the systems we rely on today. It's going to be a lot of fun. I really hope you stick with it. See you there. Thank you for watching. Please like and subscribe if you found the video useful, as we're trying to rebuild this channel, updating all of our videos all at once. So ask questions in the comments and let us know what topics you think we should cover. See you soon.